It's time for our weekend health roundup. And to break down some of the biggest headlines is ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel. Always great to have you, my friend. Okay, let's jump in with this. Drug maker AstraZeneca is launching an at-home delivery option for the flu vaccine nasal spray. It's called Flu Mist. But before now, you could only get this spray at a pharmacy. Does this mean that we don't necessarily need the shot? Break this down for us.
This definitely means that for people out there who don't want to either go into a pharmacy or get the injection, there is a convenient at-home via mail option for people. I want to remind everyone that Flu Mist has been FDA approved, meaning it has been shown to be safe and effective for about 20 years. It is an option for people who are eligible, but with each year, we seem to see this dip in flu vaccination rates. It kind of goes up and down. Part of it is related to vaccine hesitancy, people not wanting to get the shot, but a large part of it is people who are busy and they don't have time and they say, I'm going to put this off, I'll get it later. And then all of a sudden, it's spring. So for this population, getting something by mail could be extremely convenient and it's pretty easy, Morgan. You get it in the mail, you need a physician prescription to get it, and it's just like an over the counter nasal spray. It's one spray in each nostril and you're protected.
And most importantly, you avoid that scary needle, which is always like my problem, but I still go through with the shot. Okay, so let's talk about who is eligible to get this. We know that there are thousands of U.S. deaths every year from the flu. Of course, that will be fastly approaching as we get into the fall and winter season. What do we need to know?
Well, first of all, I need to give you credit out there because you said that you're scared of needles, but you still do the right thing and get your flu shot. For anyone out there who is scared of needles, we have techniques to help you get through it. I'm just saying, even little kids. But the people who are eligible for this flu mist are typically individuals about age 2 to 49, people who are otherwise have underlying healthy immune systems. We don't want to give this to people who might have an overt reaction or pregnant individuals. One key difference is flu mist is a live weakened version of the virus. The injection is a completely killed virus. The reason that's important is you may see side effects from the flu mist, which is why it's important to have a conversation with your doctor to get that prescription and make sure that it's right for you.
Yeah, I'm really glad you pointed that out. One other thing that I want to ask you about, Dr. Patel, and this headline really caught our eye. A new set of data from Epic Electric Health records about autism found that the median age for autism diagnosis in boys actually went down from 7 years old to 5, but the median age at which girls are being diagnosed remained pretty steady at 8 years old. What do researchers make of this gender gap in diagnosis?
Well, foremost, it is a good thing to get those early diagnoses because with individuals with autism, we aren't trying to cure autism. We're trying to help people thrive and live their best life and get them early support. But as you mentioned, the researchers looked at this, saw a gender gap, and it might be attributed to three factors. One of them is a difference in symptoms between girls and boys, a lack of awareness, and Morgan, some gender bias in the data and how people perceive these symptoms. So, autism spectrum disorder, which can vary by the individual, is really defined by some challenges with social interaction, languages, and then some features such as repetitive behaviors. Now, girls might be more likely to mask these symptoms. They can fake eye contact, memorize speech patterns to try to fit in and hide their autism symptoms. And these repetitive behaviors in girls, these emotions, might also be dismissed as them being women or personality, which is very unfair and kind of taps into gender bias because earlier diagnosis means earlier support, school therapy, and more. There is a reason why in women with autism, 1 in 4 are diagnosed into adulthood. So not only do we need to have this conversation, make sure that we're removing gender bias from not only autism, but from all conditions, but we need to pay attention to the fact that when we're doing research about screening tools and symptoms, the research population needs to be diversified because a lot of the early research in autism symptoms were done in men and
Yeah.
boys.
Absolutely, and it's such an important conversation, and I'm glad that you kind of dove into that. Before I let you go, this next one is for pet parents. Okay, so a new study finds that dogs often mirror their owner's health, and then this new research shows that patterns of canine diseases can reveal important clues about human illness. So, Dr. Patel, what are your big takeaways from this study?
You know, our furry friends, Morgan, teach us about loyalty, having fun and love, but this research set says that they might also be able to teach us about diseases of aging. And this whole concept of one dog year being 7 human years has given researchers a little bit more insight because what they basically found were these clusters of illness that tend to associate with each other. Some of them are not surprising in dogs or humans, such as hypertension possibly leading to kidney disease, or diabetes possibly leading to eye disease. But in dogs, researchers also found some unique patterns, such as protein loss in urine leading to or being associated with anemia or a low blood count. And so researchers looked at this, and there's no clear conclusions right now. It's an early data set, but it is fascinating to think about the fact that dogs age faster than we do, have the same environment, same living conditions as their owners do, and could they potentially give us some insight into know what diseases might be paired together, how to prevent them, and how to make sure that we're all aging together, furry friends and humans, as healthy and happy as possible.
Well, they always say like the more that you're around your dog or your dog starts to look like you is what I've always heard. So I guess there is some scientific truth to that, or at least some science is emerging about that when it comes to
So
our
we're
health.
all living together, and I see those Instagram meme now of like the dog owners and their the dogs themselves.
Yeah. All right, Dr. Patel, thank you so much for joining us. As always, we appreciate your insight and expertise.
Happy Saturday.